If the gene stops working, the risk of the cell turning into a cancer cell then becomes higher.
We do also encourage them to go for genetic testing.
We usually will use a blood or a saliva sample.
I'm delighted to be chatting today with genetics counsellor Sook-Yee and clinical oncologist Dr. Jennifer Leong about genetics testing. Dr. Jennifer, in terms of someone actually doing the gene test, why might you be advising them to do a gene test?
Again, patient asks that, does my treatment change with it? And I think we lived in this exciting era where we say it's precision medicine. If we find a genetic alteration, we can use this knowledge that we have a genetic alteration in the patient to their advantage. So there are newer and newer introduction of a targeted therapy that we can use that can actually benefit them in terms of their treatment outcome. So I said it simply that if you find the right key for the right door, you can sort of lock the cancer away. We know that if we start someone on a targeted therapy where it's suitable, then we can actually improve their survival outcome. So in the long term, you're actually really trying to halt the disease progression for as long as you can. And that can actually reduce the treatment cost as well.
So gene testing is identifying that door so that you can then use the key, the treatment, to match that door.
Exactly. So one is to add value to their treatment to improve the outcome, because it's no longer one size fits all for treatment. Not everybody needs chemotherapy, or their journey doesn't just end with 6 cycles of chemotherapy. So there could be more things that we do, such as maintenance therapy. So this is where this comes in. Secondly, of course, by doing the genetic testing, it has an implication in that we can manage their cancer risk better. Just as Sook-Yee has mentioned, this can allow an individual to identify or assess their risk of developing cancer in the future, and also how to take preventative steps. Whether to start screening earlier to detect cancer early, because we know early detection of cancer, which is what we advocate for, is going to definitely improve survival outcomes. So that's one thing, or to prevent the cancer as well.
I see. Sook-Yee, did you have anything to add to what Dr. Jennifer was saying? I mean, in terms of like using gene testing for tailoring treatments and also for preventing cancer from relapsing, I suppose, or future. How about to like the family members?
In some cases where we are able to identify the actual gene that's at fault, then we know that there is a possibility that the patient's family members who are blood related may also have inherited or carries the same genetic fault. So we know that, then we can work with the family members even before they have developed cancer, if at all, and have a plan to manage the risk. So that was the prevention that Dr. Jennifer was talking about. So that's a big area that is also very important for those who are in the family, right? So unfortunately, the first person to test is always sometimes a shock, right? But once the shock has settled, they will realize that the information is actually very important for family members, almost like a warning system in a sense, an early warning system.
That could really help even pre-screening, because some family members might not be screening, and then you sort of get an alert and then you start going for your screening, isn't it?
Yes. That's right.
Sook-Yee, I wonder, in your practice, in your clinical practice, in terms of counseling, would you have any case examples to share with us today, a challenge that you have with a patient?
Yeah, so I can remember clearly a young patient who had breast cancer at an early age, at 28, and she did have some family history. Because of her young age in particular, and with some family history, so genetic testing was offered to her, and it did turn out that she was a carrier of a BRCA1 mutation. Now, what's interesting is that she had a little bit of initial difficulty accepting the information, but with reassurance, she did accept it, and she went on, she got married, and she had children. What was interesting is when she said, she actually felt that she would know what to do with her children, because she knows what's happening. She knows what was the cause of the risk in the family. And she has been very good with her risk management program. So because she was young, we had to make sure that she had her follow-ups in the right protocols for her other healthy breast. And she was planning for her family and so on. And post having her children, what the gynae oncologist would be working with her for her ovarian cancer risk. So the thing is, she actually came back to us, and we do follow up with them on a yearly basis. And, you know, you can see the transformation from someone who's just had an early diagnosis, understanding why that happened and what's happening in a family, and for her personal journey, getting married, becoming a mom, having children. So it is not all gloom and doom in a sense for anyone who has found to be a carrier, right? She's shown that, as an example, that the information can be very powerful and in some ways reassuring, because they're no longer grasping to why there is such a high risk in the family. In addition, the family members did test, and those who were well and were carriers also went into a program with a well-evidenced protocol. So they knew how to screen well and when to screen. So it became important. Empowering information for this family.
When you explain it like that, it suddenly goes like bulb in my head, you know, like, yeah, this gene testing is actually a tool. It means that we don't actually have to drive blind as a family. We sort of have a map as to what to do. Actually, I want to touch on something that both of you said. You raised that, you know, there might be concerns, and it sort of relates to what you're saying as well, how it affects the family members. Jennifer, Sook-Yee, would you be able to just touch a little bit on that? What is the concern really for family members to know? I mean, is there a problem?
Well, I guess it really depends on the individual, firstly, right? Some people may feel uncomfortable talking about it to other people. And within families, Malaysia as a society, you know, we tend to have very different family setups and close families with lots of members in the family. So sometimes family relationships are complicated. So one member of the family may be very keen to know about the information, another may not be. But because we know that it is an inherited risk, you can't run away from someone else who you are related to, and you know that person is a carrier. So some of these probably need to put up front and discuss before anyone does the testing. Because it is, you know, it'll be quite sad to have family relations disrupted or cause a problem within these family relationships because of the genetic test.
Right.
Yeah, I absolutely agree with Sook-Yee. I have got patient who, you know, her main reason for not wanting to do a genetic testing, even though we can see a pattern there in her family history, is because, you know, she's worried she may upset her sister. Because I think it's all about acceptance. So I think this is a delicate topic that when we spend time talking to patient and their family, it's worthwhile. But it takes a lot of effort, you know, a lot of understanding coming from our side to try to make them understand what's the rationale of doing it. So eventually, I think when they've come to acceptance that this is more good than not, then almost all of them will be agreeable to it. But till then, I think we've still got that barrier of trying to talk to them about it.
Right. I mean, the effects are quite profound on family relationships, but also on the psychological effects on the patient herself.
Exactly. So even when we reach the topic of genetic testing, we've got to find the right time. So I think a lot of women are worried on how having the diagnosis of breast cancer, ovarian cancer can impact on their children. And they're actually very motivated to get tested, primarily because of, you know, that reason.
But that brings me to a question I'm quite curious about: insurance. Because if the mother has tested for gene and found to have that faulty gene or BRCA and things like that, will it affect the insurance for the children in time to come?
So we think we should be protected, right, by this PDPA clause. But I would say that it's a positive steps in that a lot of Malaysians are now more empowered to want to ask for genetic testing. But as a fraternity, we all should stand up and let the insurance company know, because I know genetic testings, even reimbursement of genetic testings are not something that we are sure of. So sometimes we tell patients when they go for genetic testing, and these are not cheap tests. So they're quite costly. to average Malaysian earners. So when we tell them about the cost and the implications and why insurance are not, covering them, even though it's for treatment purposes. So I think as a fraternity, we should be able to unite and try to, have a roundtable discussion with the insurance company at the end of the day to tell them why this testing adds value to the treatment. Because if you can find the right treatment at the right time and you start them early rather than wait till the disease progress, as I've mentioned before, there's a lot of cost-benefit ratio to come in here. So you can inevitably save more treatment costs, and that should work better in that sense, isn't it? So when it comes to confidentiality agreement, we think that it should be protected, but I'm not sure. I think maybe Sook-Yee would be able to tell us more about it as well.
Yeah, mainly because there are no legislations in it that it's very clear to protect an individual against such discrimination. But having said that, it's always a work in progress. We are happy to note that even our neighbors in Singapore have already started with a moratorium that prevents the biased use of genetic information. So hopefully Malaysia will follow in the same way. So I think ultimately is to reassure patients that there are certain things in place, but we do need to be aware that there might be some possibility of the genetic information used that may not be so for the patient.
Right.
Hopefully this space will change soon.
I'm sure it will, with a lot of us advocating it, because it will be hugely unfair to the patient to be discriminated based on their genetic profile.
For sure. And that's why we have conversations like this. I think we need to bring this topic out there and get people aware, and we can all lobby together, as you say, as one community, right? Dr. Jennifer, do you have any last words for our ladies who are tuned in today?
I think the biggest misnomer is that someone with family history should be the one that's just tested. Those are the high risk group. But even someone without a family history may still harbor some kinds of genetic variant. So don't be afraid to ask your doctors about it. Have open discussions. And knowing that genetic testing, if you found an alteration, there is actually a treatment value to it. And of course, it can also help your family members in a way. And lastly, you should go to a proper hospital-based testing to get the genetic testing done, because this is a more in-depth DNA assessment, right? Just remember the right key to the right door.
The right key to the right door.
So everyone has a key to their door. So it's about matter of, taking the time and finding it. And when you do, like Sook-Yee has mentioned to us, it's such an enriching experience.
Fantastic. Well, Sook-Yee and Dr. Jennifer, thank you so much for your time today. We really appreciate you sharing your insights with us. People, if you're listening to this on Spotify or watching on YouTube, share with us any of your experience that you've had with gene testing. We want to hear from you, and we hope that together we could create a community that shares their health journey experience right here at Talk Health Asia. I'm Polin Lim. See you again next time. Bye for now.